Hey everybody, Tim White, clinical specialist here with the Aspen After Surgery Center. We are going to shoot a video today on what is probably the most in-demand topic of calls, emails, things coming into our center of information that people want to know, which is about liposuction, complications after liposuction, and just some general information on things patients can do to get the best results after their liposuction. So I'm going to talk about the procedure, I'm going to talk about some recommended protocols, and I'm going to bust some myths today because there's a lot of information out there that is mis and disinformation about liposuction and certain aspects about it to make sure that you get the best results after your liposuction. Number one, why do we have liposuction? We have liposuction to remove fat from areas that are stubborn or that we want to get rid of fat from, right? We want to look like this. We have a tummy, we want to remove fat, we want to look like this. But then something happens. What happens? We look like this after our liposuction. We have lumps and bumps and dips and holes, and we don't want to look like that. Why do we look like that? Well, there's a number of reasons why this happens, and the formal name for it is liposuction fibrosis. Fibrosis is basically scar tissue, but the formal name being fibrosis is where the normal inflammation after a surgery produces scar tissue. This happens in any surgery. It can be a knee replacement, it could be a shoulder replacement, it could be neurological. Scar tissue is a byproduct of the procedure. So how do we reduce that? Well, first and foremost, it's probably not a function of your surgeon or the technology or how they're doing the procedure. It's really a function of us and what we do after surgery. So as a 22-year practicing physical therapist, the first thing I tell all my patients after orthopedic and neurological surgeries is your surgery went fine, it's just your healing and recovery we have to manipulate. So how do we get the best care after liposuction? Well, number one, first and foremost, a properly fitting compression garment. So not that white Velcro binder that goes around your tummy. Anybody out there who've had this procedure and they wore that white Velcro binder, you probably notice a lump and a dip right above that binder, and you probably notice a lump and a dip right below it, right? Similar to what you're seeing here. Well, that's because that's not the proper compression garment. For anything tummy liposuction or tummy tuck, that compression garment needs to go from your knees all the way up to your shoulder, and you need to get 3 different sizes. Basically, you wear size 1 about a month after surgery, you get another tighter garment size 2 about 2 months after surgery, and about 3 months after surgery you're going to get fitted for another one that's now even tighter and smaller to basically mold your body. That helps reduce the likelihood of fibrosis. Next thing, lymphatic drainage. I cannot emphasize this enough. Lymphatic drainage is a technique delivered by a licensed professional who has to have the certification of either being a CLT, Certified Lymphatic Therapist, and be able to hold the title of being able to perform MLD, which is manual lymph drainage. So anybody watching this going to a center, if that person does not have a certificate or training in an MLD or a CLT behind their name or their title, you're probably not getting the best professional to be able to deliver lymphatic drainage. Another big myth, lymphatic massages. They are not massages. Biggest myth out there. When you get lymphatic drainage, these are very, very light massages that are meant to move fluid and move lymph through certain channels to go to what we call watershed zones, or getting 2 lymph nodes to be able to pump that fluid out of there. It is not a massage, meaning if anybody's on top of you, pushing hard, deep kneading you, pushing you, trying to pop open your incisions and your drains with that, that is not manual lymph drainage. There's something completely different, and they're super traumatic, and they're probably creating more inflammation leading to that. Ideally, lymphatic drainage should be about days to no more than weeks after your procedure. So anybody who's 2 or 3 months post-op and your doctor says, oh, well, now you can start lymphatic drainage, professionally speaking, amongst a group of lymphatic therapists, way too late. Lymphatic drainage needs to start immediately, typically within days after your procedure, and it's a series of sessions that you go to over and over and over again until your certified lymphatic therapist can tell you you're good, the tissue looks good, we've done enough drainage, okay? While still wearing your garment and following all the post-op rules. Now, despite that, we can still get liposuction fibrosis. And what does it look like? Well, it looks exactly like this. It looks like lumps or bumps or dips and knots, and once this starts, you have to provide the right type of treatment. So many patients who get fibrosis are told by their surgeons or by other professionals, oh, well, you need lymphatic drainage. It's too late. Lymphatic drainage is meant to prevent fibrosis from happening, but once you get that lump, knot, dip, or hardness, it's too late. Lymphatic drainage does not remove lumps, it prevents lumps. So what do? Well, that's where our center comes in. The Aspen Center is a group of clinicians that, between our unique technology that we're the designers of, our clinical protocols that we use, we break down the actual lump or knot to be able to flatten it, smooth it, help the body get rid of it, to be able to go from a lumpy and bumpy look to a more flatter, smoother look, because we want to look like this, we don't want to look like that. So anybody watching going, well, I've got these lumps and bumps, what do? I'm going to go get some lymphatic massages or lymphatic drainage. Too late. It's not going to help you, okay? And any clinician that's a reliable source is going to tell you, I cannot help you with lymphatic drainage at this point. Other issues to be aware of. Some doctors' offices present technologies like radio frequency or other technologies that are skin tightening. The problem with those types of treatments are they tighten skin, but they magnify the lump. So imagine, if you will, I had a golf ball, aka fibrosis, under a bed sheet, and I pulled that bed sheet tight. It'd make that golf ball stick up through the tight bed sheet even more. So we don't necessarily want to do radio frequency on lumps and bumps and dips until we get rid of the knot, the lump, or the fibrosis first. So that's where you reach out to us at the Aspen Center and go, hey, I got lumps, bumps, knots, or fibrosis. I need to get rid of that first. And then you can seek out radio frequency, skin tightening, or any other procedures. What about other common things in the industry like microneedling? Well, microneedling is basically exactly what it sounds like. It's metal needles that are being poked into your body to try and break up the fibrotic knot, but it's extremely painful. It takes a lot of procedures to see a result versus our Aspen treatment, which uses a painless sound wave technology. There's no pain, there's no discomfort, there's no downtime, there's no limitation, and we combine that with our hands-on treatment to be able to get the result that we need. So, other treatments we see out there. Wood therapy. You can go on the YouTube right now and look at all the videos on liposuction fibrosis. There's people with tools that literally look like wooden kitchen utensils, and they are just raking the daylights out of your tissue. Well, that is a coup contra coup, if you will, because the exact thing that caused inflammation was trauma. Traumatizing the tissue with these tools and being that aggressive with your treatment is only going to create more inflammation. So those treatments typically tend to make you feel better immediately because they work out the lumps and knots, but the trauma of the procedure causes more inflammation to then create more fibrosis. It's a very fine balance that we follow as licensed clinicians to be able to know how to render the treatment and the technology appropriately. So anybody with any questions, give us a call. Take a look at the 877 number on the banner below. Definitely check out our Instagram, all our social media. Click us, like us, subscribe. We do these videos. We want you to get notifications and updates when a new video comes out. Anybody with questions, if you're about to have liposuction, call us. We'll tell you the best plan of care in order to get the best result after surgery. And unfortunately, if you got the fibrosis, call us. We'll walk you through the process of how to get treatment. We can do a virtual evaluation with you from anywhere in the world. We have a 5-day fast track if you're not in town near us, in which you fly in one weekend, fly out the following weekend, and you'll probably be 50 to 80% better just in the 5 days that we treat you alone. So give us a call. We'll connect with you soon.